All right, everyone, welcome back to another episode of Evidence-Based Quarterly. Now, in this specific lecture, we're actually going to talk about the concept of immediate dentin sealing. Now, if you don't have a clue what this is, do not feel bad because honestly, until about 2 months ago, I had no idea what this even was. And so I spent the last 2 months kind of diving into classic literature, looking at old articles, new articles. I dove onto multiple websites, looked at multiple textbooks to try to really get a feel for what is immediate dentin sealing. Now, the reason why I kind of started looking at this topic was there's been quite a few, honestly, like current literature articles I've looked at that mention immediate dentin sealing, and I'm like, I have no idea what this is. And when they talked about it in the materials and methods, it was very vague. And honestly, it just didn't really give me what I needed to know about it. So I definitely took a nosedive into the books. And I'm going to present to you today some of the things I found out about immediate dentin sealing. And we're going to spend a little bit of time going through the process of how you would actually do that on a patient. So adhesive dentistry, it's really forever changed the way that we do dentistry. Now, enamel bonds, super predictable. Dentin bonds, not so predictable. And if you think about it, the majority of the time when we're doing bonding to the tooth, we're actually bonding more to dentin than we are to the enamel. And not only do we bond resin composites, we're also commonly now bonding all ceramic restorations. And so we're going to talk about immediate dentin sealing, which could improve the way that you actually do adhesive dentistry. In another video, we looked at endo crowns, and specifically, we actually looked at how endo crowns can benefit you in your practice and how some clinical considerations could actually enhance the success of the endo crown. And one of the things we mentioned in that specific lecture was the concept of immediate dentin sealing. Now, the concept of immediate dentin sealing, it's actually been around for some time. It's actually been around since the 90s. And I gotta be honest, I was not taught this in dental school. And I wasn't taught this when I did my residency. And honestly, when I talk to a lot of my colleagues, many of my colleagues do not do immediate dentin sealing. And many of them don't even know what it is. So one thing we're going to do in this specific video is I'm actually going to talk to you about immediate dentin sealing, and I'm going to use a few literature articles that I've actually read recently to kind of help guide this discussion. Now, the most recent article I'm using was a literature review on immediate dentin sealing that was published in 2016 in the Journal of Prosthodontic Research. So immediate dentin sealing is actually primarily used for indirect restorations. So like things like all ceramic crowns, inlays, onlays, etc. Now technically you do immediate dentin sealing every time you place a direct composite. Now when we talk about immediate dentin sealing, it's good to also think about the alternative option to immediate dentin sealing, which is delayed dentin sealing. All right, so if we're going to get an idea of what is delayed dentin sealing, I'm going to give you a clinical scenario. Many of you are doing Emax crowns as part of your practice. So let's say, for an example, you have a patient in the chair on day one. Today, you're going to actually prep this tooth for a crown, and then you're going to take an impression of the tooth, and you're going to make a provisional or a temporary restoration for the patient to wear until the crown comes back from the lab. So you do all these things, patient leaves with the temporary, great, right? Patient comes back at a second appointment. You take the temporary off. Now most of you, if you're doing Emax crowns, you're probably going to be bonding this to the tooth. So depending on the resin cement that you actually use, it may influence what bonding agent you use. So let's say, for example, you're going to use a bonding agent on the tooth and a resin cement. I'm just throwing out generic products right now. I'm not getting specific. So you etch the tooth, you apply a bonding agent to the tooth on that second appointment. And then you're also preparing the crown, right? Hydrofluoric acid, silane, and then you're going to cement that onto the tooth. So what you did in that scenario is you actually did not bond to the tooth until that second appointment. You never bonded to the tooth during the first appointment. Everything was done after the patient had been in the temporary for who knows how long and came back to your office for that second visit. So when we talk about the concept of doing immediate dentin sealing, let's think about some of the things that are occurring when we actually walk through that same scenario. So you prep the tooth on day one. After you prepare a tooth for a crown, or anytime you prepare the tooth in general and you expose the dentin, you actually have exposed dentin that is said to be susceptible to the bacteria in the mouth. So bacteria can get inside your prep and can embed itself into the dentin. We know this from karyology because we have different types of dentin. When we talk about karyology, we have infected dentin and we have affected dentin. Now typically the bacteria will be in the infected, but bacteria can get in the tooth, that's the point. And so you also have dentin that is susceptible to micro leakage. If the patient leaves with a temporary in their mouth, most likely they're going to have micro leakage. They're going to have fluid and bacteria in the mouth getting underneath that crown at some point during that provisionalization time period. And the dentin's also going to be potentially sensitive, right? How many times have you had a patient who had sensitivity after you place a temporary crown on their tooth? So the dentin is susceptible to sensitivity while the patient is in the temporary. And also, what about the pulp? You know, if the prep is deep enough into the tooth, the pulp tissue could actually become irritated as well during this provisionalization time period. So those are things you need to consider when you're thinking about preparing a tooth for an indirect restoration. So if you're going to do immediate dentin sealing, when do you actually apply the bonding agent to the tooth? Well, you're not going to apply it in the second visit, right? You're actually applying it immediately after you prepare the tooth. As soon as you say, this preparation is done, this is as good as it gets, I'm ready to either take an impression or I'm ready to scan this preparation if you're doing CAD/CAM dentistry. As soon as you say that, you do the immediate dentin sealing at that time period. And you're doing this before you take the impression, before you scan the tooth. It's immediately after you prepare the tooth. So you may be saying, why? Why am I going to do immediate dentin sealing right after I prepare the tooth? What's the advantages? You know, good question, right? So we're going to actually look at some of the advantages that are cited in the literature and see what that says. All right, so one of the first advantages that's cited in the literature for immediate dentin sealing, and it's the concept that fresh cut dentin is best for bonding. It's just better substrate for bonding right after the dentin's been cut. And there's been many studies that looked at how dentin can become contaminated from bacteria in the mouth, saliva, impression materials, provisional materials, and exposure to the oral cavity between one appointment and a second appointment. And what these studies have shown is that when the dentin is exposed to all these different things, it can actually lower the bond strength later when you try to bond to the dentin at a later date. So a second reason why you want to think about doing immediate dentin sealing has to do with the advantage of doing this as it relates to the actual hybrid layer. And so when you do immediate dentin sealing, you're actually applying the bonding agent immediately after you prepare the tooth, and you're polymerizing that bonding agent. And so when you polymerize that, it's actually locking that resin into the collagen fibers of the dentin, and it's actually going to give you higher bond strengths. Now, this is going to make just a little bit more sense when I give you another example to think about. And so that example is, there's certain types of resin cements and certain type of bonding protocols for restorations that actually recommend that you do not cure the bonding agent before you apply your resin in your cement or a composite. So that means you would be actually condensing or having compression of that bonding agent as you're inserting your crown or as you're placing the restoration. So there's no polymerization of that bonding agent whatsoever. Now, if you don't polymerize the bonding agent before you put some type of compression force over top of that bonding agent, then the bonding agent's going to basically disperse itself. And it's going to be a lot harder for that bonding agent to interlock with those collagen fibers. So anytime you can place a bonding agent and you can cure that bonding agent, that resin in the bonding agent is going to interlock in those collagen fibers, and it's going to create a very strong and stable hybrid layer. Now, I'm going to give you a good example of when you would not cure the bonding agent and how that could impact the stabilization of your hybrid layer. So in the clinic I work at, we actually use Reliax Ultimate, a self-adhesive resin cement from 3M. And that specific resin cement actually has a bonding protocol that recommends that you use the product Scotch-Bond Universal, which is a universal bonding agent. And in that specific protocol, they actually recommend, let's say you're cementing an Emax crown, they recommend that you apply the bonding agent to the tooth. Now you have the option in that scenario to do total etch or self etch or selective etch. So whatever you choose, you apply the bonding agent to the tooth and then you do not cure it. And basically after you've got the crown prepared, you put the resin cement in the crown and you cement that crown over top the uncured Scotch-Bond Universal on the tooth. And then at that point, once the crown is seated, you tack cure, remove excess cement, and then you completely cure the crown from multiple angles. So that would be an example of a protocol that recommends you do not actually cure the bonding agent before you place the crown. Now, there's different reasons in the literature why you would not do that. One of the reasons why is because some say if you cure the bonding agent before you place your crown, the crown may not completely seat all the way. So you could potentially have some slight open margins. Now, a lot of times this hasn't been so clinically significant that it's a deal breaker. But some people advocate not curing the bonding agent. Now, a lot of bonding agents do need to be light cured. They don't have that option to self-cure. So that needs to be taken in consideration as well. So a lot of the stuff I'm talking about, it really somewhat depends on what products you use. At the end of this specific video, I'm going to give you 3 examples of immediate dentin sealing. One's going to be for a 3-step etch and rinse bonding agent. One's going to be for a 2-step self-etch bonding agent. And the third one's going to be if you were using Scotch-Bond Universal. So a third reason why immediate dentin sealing can be advantageous is because it actually allows the bond to mature over time, or it allows the bond to the tooth to actually develop over time. So if you do that immediately after the preparation and you don't actually cement your crown till a later appointment, that bond will actually mature and that bond will be stronger on the day of cementation. So if you think about it, you place a bonding agent on a tooth, you cure it, you immediately apply like a composite, or you immediately apply the crown. There's going to be some shrinkage of that resin. So if it's composite, there's going to be shrinkage of that composite. And as that composite has polymerization shrinkage, it's actually going to put some stress and strain on that actual bonding interface. And so the cool thing with immediate dentin sealing is if you do that immediately after you prepare the tooth, and then at a later point you do the actual restoration, that bond's going to be a lot more mature, it's going to be a lot more stable, and those shrinkage forces will not put as much force or strain onto that dentin bonding hybrid layer interface. Now truthfully, that advantage may not be as beneficial if you're doing same-day CAD/CAM dentistry. Because let's face it, one of the perks of doing CAD/CAM dentistry is to actually deliver the crown on the same day as the prep. So in that essence, the bond probably will not really mature that much, so that advantage may not be as critical. And if you think about it, if you allow a bond to mature and it actually gets better over several days. That can be very advantageous if the preparation is not really ideal in terms of resistance and retention form. So if it's adhesive preparation, you may actually have less retention and resistance features. But if that bond's allowed to mature over a few days and then you come back in and you cement your crown, that actually may make for a stronger bond to the tooth, in which case the immediate dentin sealing actually increases the strength of your final restoration. The actual bond to the tooth is stronger. So a fourth reason why immediate dentin sealing is advantageous is because when you immediately seal the dentin after you prepare the tooth, it actually prevents bacteria from colonizing the dentin. I mean, really, that's it, you know. No bacteria in the tooth, 2 thumbs up, right? And so last reason I'm going to actually mention for an advantage of immediate dentin sealing is it actually minimizes dentin sensitivity. If you immediately seal the dentin after you prepare the tooth, the sensitivity of that tooth is going to go way down because you've occluded and you've blocked all the dentin tubules. And so, especially if the patient's going to have a temporary in their mouth for a couple weeks, their risk of having sensitivity is going to go down because you did immediate dentin sealing. And a lot of times the sensitivity is so minor that on the day of crown delivery, if you're doing the crown delivery on a second appointment, the day you do that, you may not even have to give anesthetic because the patient's sensitivity is going to be very low and their tolerance for you taking that temporary off and preparing that tooth for the crown cementation is probably going to be pretty good. So that's a huge win because that saves you time on your delivery appointment. So you may have a lot of things running through your head right now about immediate dentin sealing. And don't feel bad because I did too. And so one of the questions I actually had was, well, if you're doing immediate dentin sealing after you prepare the tooth, you know, and you've taken the time to make sure you reduce the tooth enough, how thick is that dentin bonding agent going to be? And how could that, you know, essentially interfere with my material space requirements? So when you actually look at the previous studies on this concept, what you'll learn very quickly is that the thickness of the bonding agent, it varies. It depends on what specific part of the prep you're talking about. It depends on what type of bonding agent you actually use. And the thickness of the dentin bonding agent can actually range anywhere from 60 microns all the way up to 500 microns. And really, if you think about it, because it varies and because it's a little unpredictable to know how thick that's going to be, you really do not want to do immediate dentin sealing in any situation where the space requirements are very precise or they're very minimal. And so a good example of this would be veneers. Veneer preparations are very small, right? You're not removing a ton of tooth structure from the tooth. And so the veneers themselves are super thin. You really don't have the room to do immediate dentin sealing right after veneer preparation and still have sufficient thickness or remaining space for your veneer. All right, so enough about the advantages of immediate dentin sealing. There's a few advantages that are important, and probably the biggest one is the fact that you're getting a very good bond to the dentin because you're doing it immediately. Remember, over time, that bond is actually degraded from things like, you know, oral environment, provisional materials, temporary cements, etc.